people think social media trolling is all jokes until one of your closest friends or family members attempts or commits suicide. Because of it, sometimes not pressing the tweet or send button is the strongest things and the best decision you'll ever make in life. That's a pin tweet from Bravin Yuri. Today at the Discourse KE, we're going to talk about mental health. My name is Emmanuel Mamadi, and my guest today is Bravin Yuri, a sociologist, a political scientist, and also someone who advocates for mental health. Karibu Bravin. Now, are we operating on a code red when it comes to mental health in Kenya?
Yeah, actually, the cases on mental health in Kenya have increased, and with the pandemic coming through, it's even been more worse, especially among the youth and the Kenyans in general, because you can see that when the pandemic came, so many people lost their jobs,
Yes.
and unemployment has really been a very huge challenge when it comes to mental health.
So we're operating on a red in Kenya when it comes.
Yes.
So it's an emergency response that is supposed to be made.
Yeah, I would actually advocate for the president to actually declare it a national disaster.
Before we come to that, we'll come to that about the declaration of the emergency, because there's a task force that was formed to that. Now, what are the challenges? Besides, you mentioned unemployment. What are the challenges? Other challenges that lead to this, especially the mental health in Kenya?
Yeah, actually, unemployment is actually among the youth is the leading factor, because it's affecting so many. So many are actually sinking and dragging into depression because of unemployment. Then we have the issue of the cost of medication or healthcare generally, because you can find that there are families that are undergoing what you call treatment of chronic diseases, let's say cancer. Most of them are spending so much money treating their loved ones, so they end up falling into financial crisis. So this in turn contributes to depression to the family, and there's so much that comes with it.
Okay, World Health Organization records roughly 800,000 people die every year. It's a result of suicide. Now, how do you link suicide, especially to mental health?
Yeah, actually, the same World Health Organization has estimated that suicide is the second leading cause of death between the age 15 and 29.
Yes.
Yeah, so you can actually tell that suicide is actually one of the biggest things or topics that you should talk about in mental health, because we are having so many cases of suicide, especially even in Kenya right now. We recently had even a 6-year-old in Kilifi who committed suicide. Yeah. So when it gets to a point where a 6-year-old is committing suicide, that shows there is a need for intervention.
Okay. You've been a very added health organization or health advocacy. That's what you've been doing, mental health advocacy.
Yeah.
Especially on Twitter.
Yeah.
We see about your pin tweet that I've just read. Yeah. So what informed this?
Actually, I have experienced I can call it stress and depression towards because I had to look for a job, and it was actually hectic, so it kind of ate towards my mental status.
Unemployment. That's
unemployment.
Yeah. Depression.
So I also had to quit my job because of toxic working spaces. It also affects so many people when it comes to mental health. When you are working within an organization that is actually probably exploiting you in one way or the other, you feel like you are being oppressed in one way or the other. You see, it sometimes eats you up when it comes to your mental health. So I've also been trolled, on social media. So I also have the first-hand experience of what it can do to someone. So it's something that motivated me to start talking about mental health.
How long did you start this about mental health?
It's been about 2 years.
2 years.
It's been about 2 years since I started.
How has the journey been so far? What strides have you made?
Actually, I've made so much strides when it comes to mental health, because like right now I have a WhatsApp group, and I'm also I have a website mentalhealth.co.ke, which actually I'm still working on it to make sure that it can provide a platform so that anyone with mental health related issues can actually seek help. Because I've partnered also with some specialists who are offering pro bono services to those who are willing to get help. Yeah, so most of the people come to my DM with an issue. So if they want to get help, I can direct them to the specialist to handle the cases. Yeah.
It's such a worthy cause. Now, we've talked about social media. You've been a victim of being trolled. So, how does this really affect most people? And how do we correlate mental health with social media? Because we've seen so many people have been trolled, body shamed, and everything else. So, how does this affect people? What would you say to those people? We call them keyboard warriors.
Yeah, actually, most of the time people think that what you say on social media doesn't actually matter. But you cannot separate your life from social media and reality. These days, we are doing business online, so it's like your life is online. So you cannot basically differentiate the two. What you're doing online is basically part of what you'll be doing offline. So if someone abuses you online, it's basically directed to you as a person, even off that, because trust you me, if I abuse you online and we meet, we won't be having good blood between us. So it's the same way. If I troll you online, it simply means I do the same offline, or it's the thoughts I've been having offline about you. So it actually relates, because it's actually an opinion I have about you. And this affects, how you think about someone. When you tell someone mean words, they directly affect the person. Some people might not know it, because most of the trolls actually have a problem that they have not dealt with themselves. Because if you try and follow up, most of them have an issue with their life in one way or the other, but they're taking it out on someone else. There are people who need help. Actually, cyberbullying has actually increased, especially on social media these days. On Twitter specifically, it's too much. And there should be mechanisms to regulate it, but still it's too much on social media, and it's actually eating up on so many people, because you can see, even we had Lamua being trolled yesterday. It was Nikita Kerin who was being trolled.
She turned 19.
Yeah, she turned 19 yesterday, and she was being trolled for all that, and it can't make sense to you, but to the person whom you're trolling, it's actually hurting them.
Does this reflect the society? Does it reflect the society that is so depressed? And why is this the case?
I think the society generally is very depressed. Actually, I can say Kenya is a generally depressed nation, because we are bitter. We are always bitter about anything. Anyone does something, we are bitter. If you look at the responses people give towards each and every event that happens, it just shows that there's some bitterness in almost everyone. People are angry. Yeah, we have very angry citizens, and we think we should offer some anger management and depression-free classes or courses, or even sessions for those who are willing to go for them.
Yeah, you talked about your case of being trolled. Now, how did you bounce back now to that? How did you maneuver through? Because it's something that it hurts people, and to some people it crushes them, and in a way it connects to suicide. So how do we connect this? How did you bounce back?
If you respond to a bully, you are giving them power. So the only solution on how to cut down a bully is not to respond. Don't even respond. Just mute and move forward. If they keep coming, you can block them. It's an option you have. So on social media, that is. So basically, just don't respond to bullies. The moment you respond to it, you are giving them power, and they use it back against you.
Some people choose to remain faceless when it comes to especially Twitter.
Yeah.
And I've heard people say that Twitter is especially, you're having a conversation with a friend of mine, and he told me that Twitter is a place where you talked about toxic workplace. If Twitter were a place of work, it would be a toxic workplace, because most of the people there are depressed. Now, these people that remain faceless and they want to come and troll people, what would you say to them?
Actually, most of the bullies online lack faces, and some of them don't even use their real names. So most of the time, it's always someone you know. So they're just using like pseudonyms just to troll you because of something they probably know about you. So the only solution is to face to face the reality about yourself, accept yourself. So if anyone says anything about you when you have already accepted yourself, there's nothing will hurt you about it. Yeah. So that's the only way you can handle it. And sometimes it's okay to block those ones whom you feel they're coming at you and they are faceless. That is, you cannot. And even if they had their profile, you shouldn't respond to them with again body shaming them. Yeah. Because the moment you start that, now it's not a good thing on your end. So the best solution is just to ignore, block, mute. That's the only weapon you have. And silence is always the best one.
Okay, how about, we talked about that. Now, compartmentalizing. Now, when you say we try and compartmentalize professional life and also social life, will this be a cautionary measure when it comes to mental health, especially to the people who are being trolled? Or it will be very hard to distinguish the two when it comes to social media?
You see, when you're being trolled, sometimes it affects both your social life and your professional life in one way or the other. Because if, for example, I relate to other people on the platform and I'm being trolled for so and so, it means I'll have to deal with it anytime, even when I'm going to work. I'll have to deal with it. Probably social media is not just limited to those on Twitter only, because I can be working somewhere and I have a social media platform somewhere else. Those in my workplace have also seen what is on social media. It's not that they have not seen. So it can also affect how I relate to the people in my workplace. So it's always affecting you, either off your professional life or in your professional life. So how you handle it will determine how it will turn out in your professional life and your social life.
Okay, you talked about you once mentioned about the policies. Now, what policies should the government bring when it comes to this, or even Twitter? Say Twitter, what policies should they bring in order to curb mental health? Because I understand the government has a task force. There's an emergency task force when it comes to mental health, and it was formed, I think, in 20. And they also have a paper on it, which was in a 32-page document, which was a mental health policy, which was incepted in 2015 to 20. It goes up to 2030. So how effective has this paper when it comes to policy being, when it comes to implementation?
Actually, there is also a mental health bill that was tabled in Parliament, but it hasn't yet come through yet. But it would be good. My opinion has always been, in Kenya we lack the professionals when it comes to offering mental health help to the citizens. There's what can I call it? There are few who are qualified professions to help people with mental health related cases, and we also have less institutions. Like if you ask anyone in Kenya which is a mental health institution, most will just talk about Madari. It's actually one of the most famous government facilities that people can come to. But if someone is in Western and wants to access those facilities, how can they do it? I was proposing that in every county we should have at least one major facility, so that if anyone needs professional help, they can go to that facility. And also I would advise that the government should consider putting NHIF should cater for some of the mental health costs, because it's part of the health care. Yeah, because if you're not in the right state of mind, you cannot work, you cannot associate with other people correctly. There's always a problem when your mental health is not okay. If you're mentally unwell, then it affects everything. Your physical, even your physical health, you can't be okay if your mental state is not okay. So I would I would love to see the government accepting mental health services under NHIF, so that people cannot, it's costly. It's costly to undertake mental health help. When you go to a hospital, for example, in Chiromo, we have Chiromo, which is offering the same services. It's expensive, and it would be good if the government stepped in, so that the cost can be subsidized, so that at least anyone can afford it. Yeah.
You mentioned about Madari as a facility that is well known. Yes. Of course, Madari is well known. There was an expose that exposed Madari. I think it was done by CNN some years back, and Kenyans went ballistic about it. Now, do these facilities? Do they have infrastructure or the facilities to sponsor this? And you say that it's costly. So how do we go about this?
I think there's always challenges when it comes to every medical institution, because even in the public hospitals we go to Kennedy, we also had an issue with someone So there are always challenges when it comes to these institutions. So the best way is to make sure that at least we have so many of them, so that at least they can try to improve on the services, or else one might lose the clientele to the other. You see, it can also create a situation where at least most of them can work to reach a level where everyone can accept they are doing good. But what I can say about Madari is that they have recently improved, because I have a friend who has been managing PTSD and has been going there, and has greatly improved. And they are, and the good thing about Madari, they accept NHIF. So it's better if we have at least those facilities in every county, so that it can be better for them, because Madari is sometimes they accept all, like they accept to offer all the services, and it can weigh down on them as an institution also. So it would be good, it can't, Madari only cannot cater for the 40 million plus Kenyans who probably might need the help.
It's not practical.
Yeah, and the private institutions are the ones that are there, but they are expensive. So it can be a bit difficult, but if you make more of the facilities to be available for everyone, it can be much better.
Okay, as you wrap up, how do we create awareness of mental health, especially being an emergency issue, crisis into this country, and a priority?
We should have, I would advise we should have at least twice every year a mental health day, so that at least everyone can be sensitized about mental health. There's a lot of stigma when it comes to mental health these days. Even people still believe that mental health related illnesses are for the rich. So if you have any issue, they assume you are rich. It's not something that is okay. In fact, the stigma is even more of a problem than the mental health problem. So it would be good if we create awareness as a country. The county government, in collaboration with the national government, should help to deal with these cases, because there is so much that we need to do when it comes to mental health as a country, because so many are suffering in silence. You find that many people are committing suicide. You can't know what made them do it. So some are suffering in silence, but we should make sure we create awareness, so that these people can be able to come out and speak about their problems and issues. Yeah.
Do you have any last thoughts when it comes to mental health, or the people out there who do the bullying? What would you say?
Mostly what I would like to say to the bullies is that if you have nothing important you have to say about someone or something on social media, don't say it, because the repercussions of what you might say might be more than what you can imagine, because it weighs so much on people. There are people who are already struggling with their own demons. When you add this to them, it's a burden that it becomes too huge to bear. So you'd rather not speak anything that you think is not okay on social media.
Bravin Yuri, thank you so much for coming to the show.
Thank you for the invite.
Yeah, and I'll end with Julieta. Tell us what suicide cases has really increased into this country, but do we have the number to make it an emergency? Thank you so much.